Chairman, thank you, and to the ranking member also, and I want to thank our witnesses for being here. And I certainly want to thank you for all the work that you do for our veterans, so I want to say thank you. My question goes on the shortfall. I know it's been asked, but I want to ask it a little differently. So in July 2024, y'all projected a $15 billion budget shortfall. Then it was revised in November to 5.1 billion. That's a shift of about a little bit over 20 billion. Not 1,000, not thousands, not millions, but billions. That's a large amount of discrepancy. And I got serious questions if y'all can write down the questions. What measures are being implemented to enhance the accuracy of future budget forecasts and prevent similar situations is one question. And in that, what internal controls are being strengthened? It's the second question to ensure financial accountability within the VA. And to go into some of the questions, I assume that the financial projections were influenced by three things: lower than expected workforce costs, I assume. If that was one, delay equipment purchases. I assume that was another one. Slower growth in community care. I assume that was another one. But my question, when you talk about the measures to strengthen internal, I assume you all are using the internal control systems within the standards set forth by the GAO, that is the Green Book, the standards for internal control of federal government. I assume you all are doing that now. I assume also that you all are conducting your yearly evaluations on internal control systems to comply with the Federal Managers Financial Integrity Act of 1982 to make sure that we have the effectiveness and the efficiency in operations, reliable financial reporting, and of course, compliance with applicable regulations. And I assume also you all have been implementing the OMB Circular A123 also to do this. On the measures, and I say this to my colleagues, 14 years ago, we changed the law to ask you to do performance measures. The only thing is I couldn't get across was I was trying to add this to the appropriations where we could actually have an input. And we can still do that, Mr. Chairman. Right now, the way the measures are being done, including cost savings, they're left up to the agencies to, in many ways, pat themselves on the back because they'll put certain measures that are a lot easier to achieve. But I hope sometime we can talk about where Congress can have have a say-so on the measures that include cost savings. If we put in $1, what do we get for $1? What are the cost savings? And I haven't seen your measures in a while, but a lot of the measures we're looking at were just measures of activities and not results, results oriented. And I think you know what I'm talking about. But anyway, I have a couple questions that are down the line as the chairman and the ranking woman also. But I want to ask you about some of the internal measures.
Absolutely, Congressman. Just to clarify one thing, we had estimated a potential need in FY25 as of July to be $12 billion for VHA. We have not yet submitted what that revised number will be. We know it will be lower, potentially substantially lower. Again, based on all the factors I mentioned, our operators managing as closely as they could to the budget and ultimately staying within the enacted budget, affording us the carryover approximately that we had estimated originally in the budget. But then there are also elements that we expect, like increased pharmaceutical, prosthetic costs, and other systemic factors in healthcare that will factor in to that ultimate need. On the budget formulation review that we're doing, as Congressman Rutherford mentioned, dynamic factors in play here. We hired a huge number of people, unprecedented number, all-time record of more than 60,000 people in FY23, precisely to prepare for robust implementation of the PACT Act, because we were also doing an unprecedented outreach campaign to bring more veterans in. And so even if we are off by about 2% in the cost per FTE, which is approximately what we were off by as of July versus what we know now, that translates into well over $1 billion of difference in the actual outcome. And so we're really looking at these factors. We want to make our projections as better and ultimately more accurate. But there's a very dynamic last few years in play here. We're also just finished our audit with the OIG on complying with all of the different parameters that you mentioned. And so we're taking that. We've improved year over year, but there's still things that VA needs to work on. And of course, we welcome your oversight and accountability on outcomes. Our most important outcomes are veteran trust, which stands at an all-time high of 92%, quality and patient safety outcomes, which VA outperforms the private sector by 60%, getting the top 2 grades versus 40% of the private sector. And of course, access, wait times are down, primary care and mental health. And when it comes to actual care delivery, we are up significantly, breaking records every year in appointments delivered.
And we thank you. My time is up, Mr. Chairman, but if you recall, in the state of Texas, we actually did put performance measures where we actually sat down with the agencies and looked at them, and there's a way we can add them to the report language at least, so we can see customer service, like you mentioned, and thank you for a good job on that. You can look at cost savings. There's a lot of things we can do, and maybe next year we can look at some of that. And Florida also has done that also. I know Texas and Florida, and probably the other states also, Nebraska and the other folks have looked at this, but it's something that we should start thinking about having a say-so on performance measures. But with that, thank you, Mr. Chairman, Ranking Member, and to both of you, thank you for what you do to help our veterans. Thank you.